joining the webinar. The world of social media is evolving every day. We must begin to explore strategies to expand our reach. Today is the first of a two-part webinar on this topic. At the conclusion of this webinar, participants will be able to identify 3 ways that social media can impact patient-centered care and clinical operations, practice patient interviewing and questioning that builds trust and trustable information, perform a patient-centered sexual history using an electronic medical record, identify 2 to 3 strategies that can be used via social media to transform medical education and clinical practice, and understand the importance of culturally and linguistically appropriate services in health and healthcare. Today we are excited. We have a diverse range of speakers. Your first speaker is myself, Dr. Katherine Brown. Then we have Dr. Chelsea Unruh, Jamie Allen, Abraham Johnson, Robbyn Kistler, Robbyn DiPietro, and Dr. Lauren Beauchamps. I'm from the Windy City of Chicago, and currently I serve as the Director of Communities of Practice for the National Center for Medical Education, Development, and Research at Meharry Medical College, and we are in the Department of Family and Community Medicine. So who are we? We operate under the leadership of Project Director, Dr. Patricia Matthews-Juarez, and Center Director, Dr. Paul Juarez. We are housed again in the Department of Family and Community Medicine at Meharry Medical College. Our focus is on transforming medical education for vulnerable populations, specifically LGBTQ persons, homeless persons, and migrant farm workers. And our project is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. The specific aims of our center are to link with national partners to conduct systems-level research of evidence-based interventions to inform primary care training, to disseminate best practices and resources to transform training and clinical practice and improve clinical outcomes, and to establish communities of practice to promote enhancements in medical education that will produce a better prepared primary care workforce and better health outcomes for vulnerable populations. Knowledge must not only be generated, it must be transformed in innovative ways for integration into medical education. So what are communities of practice? Our community of practice incorporates you, and we are a group of people who share a concern or passion for something that we do, and we learn how to do it better as we interact regularly. We have 7 principles. The first one is knowledge generation. We have a dynamic and well-prepared research team who do a lot of studies and research to generate knowledge. And then we bring that knowledge back to our community of practice. Through this transference of knowledge, we are very excited that we don't look to do things the same way. We are looking for innovative strategies to integrate this information into medical education for a system change. We want transformation. And not only do we want transformation, we want sustainability. And we thank you for helping us achieve our goals. Our research team, and I will introduce our research team later on during the webinar, focus on building the evidence base to drive curriculum development and medical education to address the needs of vulnerable populations. We disseminate this information and we focus on improving health equity through clinical outcomes and documented information among vulnerable populations. There are several types of communities of practice, from mentors, providers, researchers, clinicians, and national partners. And our national centers brings all of the stakeholders to the table. Now, you may be asking yourself, why establish communities of practice? Well, we want to promote better health outcomes for vulnerable populations. Establish group of like-minded individuals, share and generate knowledge from a cultural lens, strengthen communication and relationships among our collaborators and partners that possess different knowledge while addressing a wide variety of needs specific to vulnerable populations. On today's webinar, we not only have physicians, we have ambassadors, patients, and people from national centers. And that is the beauty of the community of practice. Our target audience: academic medical professionals, national service organizations for vulnerable populations, primary care providers and health insurance plan executives, public health providers, public officials, policy analysts, the lay community, community leaders, faculty, and patients. Here's what we've heard from you. Patients use social media prior to going to medical providers. This misinformation sometimes can occur via social media, and it can influence patient interactions with providers. When patients post negative comments about providers, it may influence how other patients choose to follow up for treatment with that provider. Patients who don't feel comfortable coming to providers may utilize social media to self-diagnose themselves. What does this mean for us today, community of practice? It's very simple. We cannot afford to ignore the power of social media. So today we will discuss resources available to work with vulnerable populations, ways medical professionals can share accurate information via social media, and sharing databases of trusted sites with medical professionals to streamline where they post and retrieve information. The benefits of social media: knowledge sharing, staying connected, and we did include our hashtag NCMEDR_Meharry, sharing mutual messages, reduce time and cost, and then ongoing and constant knowledge generation, dialogue between stakeholders and content experts, and the ability to connect with diverse audiences nationwide. Our first speaker is Dr. Chelsea Unruh. Dr. Unruh is a genderqueer board-certified family medicine physician practicing in a semi-rural clinic in Yelm, Washington at Yelm Family Medicine. During residency, Dr. Unruh helped start the Lily Clinic, a transgender medicine specialty clinic at the residency program. Welcome, Dr. Unruh.
Thank you. So, being a genderqueer provider, I have been had the experience of being on both ends of receiving and providing medicine. And I'm going to start with a little bit of what we would look for in a LGBTQ friendly practice, and even start with LGBTQ. That is kind of an umbrella term that is standing for lesbian, gay, bisexual, transgender, and queer questioning. There can be a number of other letters that add on to that, and it encompasses a wide variety of community and patients. So a clinic that would be friendly to the LGBT community is going to be one that feels safe. That's the biggest part. So it could be any specialty office, because just like any patient, you may need to see a primary care provider, a surgeon, dermatologist, etc. So this is not specific to one specialty. Coming from family medicine, that's where my mindset is, but it can go across all specialties. An intentional space is something that is important, and that may be that would include the waiting rooms, reception, and clinic rooms, as well as the restrooms, gender neutral restrooms, and having that option available, or having it be the only option, is really important, particularly for the transgender population. There's other things that you may want to think about in those spaces, which would be being aware of images, and particularly of cis and heteronormative photos, pictures, health posters, displays that are in those waiting rooms. That can make a big difference in terms of the space feeling safe to specific individuals. That inclusive people includes everyone someone comes in contact with. So your front desk, your nursing staff, your providers. I'm having a cat fight going on in the corner here, sorry. That inclusive people would be folks who are trained in the questioning that needs to occur, that is competent in asking people's pronouns, asking people about legal names versus the names they go by, and if that may be different on insurance. And having regular conversations about that and regular trainings. Patient-centered paperwork, open-ended intake forms can be a huge part. Many people use intake forms that match their EHRs. EHRs are changing now with Meaningful Use 2017 to include gender identity and sexual orientation. And a lot of our forms don't match that yet. Also, nobody really wants to check a box. None of us want to fit in a box, and many of us don't fit into a box. So open-ended questioning works better for some folks. One thing that's important too for any clinic is that the clinic is open and inviting to patient and consumer feedback, that really your patients are your consumers, that they and their insurance companies are paying your bills. And so being open to their feedback and listening to their feedback is important. And then having everyone in your office being able to use culturally and linguistically appropriate language and provide that service. So in terms of being a provider and working with this group, we're talking about social media, but one of the things that social media can bring into the room is maybe an inherent distrust of the of the medical providers and medical community, which a lot of folks within this LGBT community already have that inherent mistrust. So building trust, you know, Sir William Osler said, the good physician treats the disease and a great physician treats the patient who has the disease. And we're all patients. On to the next slide. Different ways of building trust. This is a quick list, but it's so important. And this can go to any patient you come into contact with, of asking questions, being engaged with the patient, and listening. That word got cut off, but it's so, so important. Listening. There have been a few different research about how doctors do listen or don't listen. And in 1999, JAMA said that the mean length of time it took a doctor to listen before they interrupted and directed the conversation was 23 seconds. And that's not very long. So listening is key. Normalizing and validating by asking questions, saying, I ask these questions to every patient, and introducing yourself with pronouns. That, hi, I'm Dr. Unruh. I use they, them. Do you have a preferred pronoun? What name do you go by? Perfect. And asking questions in a normal tone. I also put that with knowing your facial expressions, because if your facial expressions are showing awkwardness or discomfort, your question's going to be awkward or uncomfortable. Asking gender neutral and open-ended questions. So that could be particularly when taking a sexual history, about partners versus your wife or your husband. Do you have children rather than sons or daughters? And so forth. With family, there's generally gender neutral words you can use for a lot of those relationships. And when you are working with a patient, recognizing your own bias and privilege is important in understanding how to communicate with that patient. And by communicating in a way that you both find mutually respective, that's going to build your trust with the patient, and they're more likely to listen to you than to social media. So the pronouns and parts, talking about sexual orientation, gender identity data, and the sexual history. When do you take a sexual history? Every new patient, every adolescent and adult patient. Each annual exam that you get, particularly since things like gender identity and sexual orientation can change over time. And particularly number of partners can change over time. And then any problem pertinent visits, if they're coming in to say, hey, I think I have an infection, or I want to talk about PrEP, those would be times to take that history as well. Using patient-centered language is really important. I try to mirror and reflect the language my patients use and use that language back with them when communicating, particularly about body parts and about their relationships with others. Avoiding medicalized terms or jargon can be helpful because a lot of people don't know them. I've even gotten to the point where I have stopped asking people if they're monogamous because I've had so many patients not know the word. So in terms of how to set the stage for sexual history, I always make sure to say, listen, we're getting to the sensitive part of the interview. All of these questions all the answers are confidential, and this is gonna let me provide the most and highest quality of care that I can for you. And that some of these questions may be uncomfortable, but believe me, I do ask them to everyone. And let's get started. Do you have any, then we get into the SOGI data, the sexual orientation, gender identity. Some of this may have already been taken care of at the front desk, but if it has, verify it. I see that you identify as female. Do you have preferred pronouns? She, her? Wonderful. How do you identify your sexual orientation? Or I see that you've marked here that you are married. Is that, which relationships have you had and how do you identify? For sexual history, the CDC actually has a pretty decent 5 Ps, which include partners, practices, protection, past history, and pregnancy. I think for some of these in the LGBT community, we focus on more than others. However, particularly working with a number of trans patients, pregnancy needs to be addressed. So partners, to go through those, each partners can include how many in the last year, and what are the genders of your partners? It used to be men, women, or both, but particularly working with the transgender community and being genderqueer myself, that men, women, or both doesn't really fit everybody. Practices can include drug, alcohol, as well as what goes where. And sometimes I ask it like that, do I need to be screening your mouth as well as your genitals? Here are some examples of infections I found in different places. This is why I ask. Protections from STIs, that can be a huge part and is one that also is really big for the LGBT community, obviously, and we'll get into that farther on. Past history of STIs can also lead to risk stratification, and pregnancy, particularly in couples where they do not appear binary in the 2 genders, that making sure that if there is a sperm producer and an egg producer, that if there is a way to prevent pregnancy, that's important. The 6th P, I've had be proposed to be preferences. That can be your pronoun preference, your name preference, or as parts, and having it be an organ inventory, particularly in the trans community. And that with a sexual history, it's very important that you've established some trust with your patients before you launch right into that. Some people are going to be more open to it than others, but that trust is really important.
Thank you, Dr. Unruh. Today, we've asked 2 Greater Than AIDS ambassadors to join us and share their personal experiences as members of the LGBTQ community about accessing care and sharing health information through social media. Our first ambassador, Abraham Johnson, is a Greater Than AIDS ambassador. He has been one for 4 years, and he recently appeared in the We Are Family campaign, addressing the importance of supporting people living with HIV. Welcome, Abraham. I have 2 questions for you today. Would you please share with us some personal insights you've had accessing care that made you feel more comfortable or less comfortable, as well as any insights you have for our providers and community of practice members today about how gay men are using social media to exchange health information?
Good afternoon, everyone. My name is Abraham. I was diagnosed HIV positive as a freshman in college, and I was 18 years old. One of the things that my doctor did for me was we developed the 80-20 rule. And by that, I spent most of the time talking, and she spent most of the time listening. By developing that trust with her, she was able to cater my care to my needs. For instance, she would ask me questions about my sexual history and my partners at the time, which I didn't have any because I was newly diagnosed, but just making sure that she addressed my overall needs. At the time, I was really depressed, and she linked me to a therapist. So all those things were able to get me to become virally suppressed. So as the doctor stated, it's all about developing that trust and that relationships with your patient and ensuring that the patient gets the best out of their appointment. Thank you.
And are there any insights that you have for our providers and community of practice members about how gay men are utilizing social media to exchange health information?
Definitely. There are so many different outlets for gay men to talk about sex and HIV. One of those is Facebook. There are so many Facebook groups that are out primarily for gay men. So I would ask your patient, are you in a Facebook group, or do you utilize Facebook? Snapchat also is another tool that a lot of people are using in the LGBT community. But I know for sure there are so many platforms on Facebook where people use the hashtags and they talk openly about sex and HIV. So just finding that network that your patient may belong to. Instagram is another tool that people use to not only communicate, but also post pictures. And it makes a person feel a lot more welcome when they're about different sexual topics. So just finding out that social media that client or patient uses.
Thank you, Abraham. Our next Greater Than AIDS ambassador is Jamie Allen, who is a project coordinator for Recovery Consultants of Atlanta. Jamie has been an ambassador with Greater Than AIDS for the past 3 years and enjoys sharing his personal experiences about PrEP. Jamie, same questions for you. Can you please share with us some personal experiences you've had accessing care that made you feel more comfortable or less comfortable, as well as any insights you have for our community of practice about how gay men are using social media to exchange health information?
Yes, so good afternoon. My name is Jamie Allen, as Katherine spoke about. For me, being a consumer of PrEP for going on 2 years, one of the things that my provider did, he didn't use a lot of like technical terms, though I work in healthcare and I know the terms. He made it real simple and real relatable, and was just real personable, as the doctor spoke about earlier. Just kind of, so to speak, dumbing it down. Just to make sure, I understand where he's coming from and things like that. One thing I do respect about my doctor also is that he understood that I'm a Black gay male, but he didn't just focus on the sex that I like to have. And I think that is the major thing with me that made it a lot more comfortable, because oftentimes I have clients that they express to me that makes them feel less comfortable just going to the primary care provider, and it's just focused on sex. And that's it. I think that, or the Black gay community, we are more than just the type of sex that we like to have, or the LGBT community for that matter. We are more than the type of sex that we like to have. So that was one thing for me that, or a major thing for me that made it a lot more comfortable. In terms of social media, I would like to point out, like Abraham said, there are those Facebooks and Twitters and Instagram, but we also have to keep in mind the non-traditional social medias, such as Jack, Grindr, Scruff. That's where the LGBT community is. And when we're talking about HIV and healthcare, period, we want to take those venues into mind, because that's where the community is. And we want to be sensitive when we're on those networking sites as well, because we do understand that the community is there for more than one purpose. But just in my research and my findings, I've been a lot more effective in those non-traditional avenues when getting clients in care and retaining them in care. Thank you.
Jamie, can you repeat the non-traditional social media? Just, I want to make sure if there are any community of practice members that didn't catch them. Can you repeat the non-traditional sites again, a few of them?
Certainly. So there is JACD, JACK''D. There is Scruff, SCRUFF. Grinder, I believe it's GRINDR. Those are just a few that I know offhand. I'm sure there's plenty more, but those are just the ones I've used in terms of retaining clients into care and getting them into care.
Thank you. Jamie and Abraham, just one more question. You all had some amazing providers. Are there any instances where you know of people that maybe felt less comfortable accessing healthcare?
For me, I got my care in Savannah, Georgia. Shout out to Chatham Care. It was all of the staff there. They're amazing, and I'm proud to say that none of my friends that I have linked to care have had anything negative to say about Chatham County, and I think that says a lot about the city of Savannah and also the doctors there. So that would definitely be a no for me.
Good.
So I've referred a lot of my clients and peers alike to Absolute Care. There I have a lot of great experiences.
Good.
With providers and things like that. In terms of negative, not so much, not from a provider standpoint, more of like a customer service. So outside of my provider, it was more of somebody in the pharmacy. But you know, with the help of my provider, he guided me and navigated me through that experience, and we worked our way around it, and it became a better environment.
Thank you. Kind of along the lines of what Dr. Unruh has been educating us on the patient experience starts when they walk through the door. And I think, like you said, Jamie, not necessarily the provider, but just making sure the office environment is friendly as well. So thank you so much. Thank you. Our next speaker is Robbyn Kistler, who is a consultant with Greater Than AIDS. And so, Robbyn, she's just amazing. So her passion is for changing the course of the epidemic, especially among young gay men of color in the South. Welcome, Robbyn.
Thank you so much, Dr. Katherine, and thank you, Abraham and Jamie, for sharing your personal experiences. I think it's a pretty bold thing to come onto a webinar with all these providers and open up so personally. So I'm sure everybody has questions for you in the Q&A section at the end, but very proud. Good job. You know, unfortunately, not every LGBTQ person has a provider who's able to give the type of experiences that Jamie and Abraham provided. An example of maybe the opposite of that another ambassador shared with me recently was when he was seeking PrEP. This is in a rural community in Texas about 2 years ago. He went to his primary care provider who he'd grown up with, seeing for years, the family doc in town that his whole family went to. And he said, listen, I have a partner who's living with HIV. I want to learn more about PrEP. Can I get a prescription? And the doctor informed him that no, he would not be able to provide that prescription based on the doctor's own religious beliefs. So that could have been the end of the story for this ambassador. He instead went to an AIDS services organization where his partner was getting care and became a PrEP client there and pushed and advocated for his own needs. But I think that's an example of a failure of providers to provide culturally competent care and really potentially harmful situation in that case. So there are unfortunately too many stories like that. Last month, well, in this month, in November, there was a national survey published by the Harvard School of Public Health and the Robert Wood Johnson Foundation, along with NPR, that was just released last week. 1 in 6 LGBTQ people say they've avoided medical care because they worried they would be discriminated against. That's 18% of this community avoiding medical care. And folks have a right to health care, as we know. So I'm talking about Representing Greater Than AIDS. We're a national public information campaign implemented by the Kaiser Family Foundation with partners across the country. We have health departments, healthcare providers, individuals living with HIV and on PrEP like Jamie and Abraham, corporations like Essence and Walgreens. Essentially, we believe that by everyone coming together, we can help end the epidemic. And we go where our audiences are, and that increasingly means online. We maintain an info resource at greaterthan.org and have over 600,000 social media followers on Facebook, Twitter, Instagram, and a robust YouTube channel as well. So if you're curious about some of the other pieces that we'll talk about in a second, you can find them all there. You can access all the content at greaterthan.org or at or hashtag greaterthanAIDS on any of your favorite social media platforms. So what you're looking at right now, if you can jump back just one slide, please, Katherine. Our colleagues at Meharry asked me to share one example of our work. It's a video series that grew out of our campaign for young gay and same-gender loving men called Speak Out. It was actually through this series of workshops designed to engage peers in opening up conversations about HIV that we met Abraham and Jamie. And in bringing them together to create their own videos, we wanted to make sure that everyone in the room had the latest information about HIV among MSM of color, about PrEP, and about treatment as prevention. So we put together an expert panel. Katherine, if you could advance the slide, please. These are Drs. Dimitri Daskalakis, who heads the New York City's HIV prevention efforts, Dr. David Malbranch, who's currently at Morehouse School of Medicine in Atlanta, and Dr. Greg Millett, who's with the American Foundation for AIDS Research. They're all specialists in HIV among gay men of color. And the conversation that we had was so frank and open, and the young men were so engaged, it was clear to us that there was a desire and need for more of this sort of access to information from providers, just like we're talking about today. For example, part of the discussion was a call to action to help normalize extragenital STD screening. One of the docs said, if you have to, advocate for yourself by saying something like, "Doc, I really need you to just swab my butt." That quote became the unofficial hashtag of the event, hashtag swab my butt, and continues to be referenced by the ambassadors as a call to advocate for their sexual health in their own social posts. I think if you think about folks coming in and creating demand for competent sexual health care for the community, as well as providers learning more to provide more competent care, we can meet somewhere in the middle. The chemistry of this panel and the men in the room was so great, we wanted to bottle it and share it beyond that room. So we made videos of the docs for YouTube. Katherine, if you could advance the next slide. So here, Drs. David and Dimitri are joined with Dr. Leandro. It was important for us to have Spanish content as well, and you'll hear at the end of this webinar from one of Dr. Leandro's colleagues in Jackson, Mississippi. And there are about 50 different videos. They're all on the YouTube channel. There's a subset of them that are specifically about PrEP, about being undetectable. What does undetectable mean? You know, why is that such a goal for folks to achieve? What are the benefits for the health of someone living with HIV as well as for their partners in the community? Oh, sorry, I just lost my place real quick. So a whole set of content. And what we've been doing with them, it's one thing to have them on YouTube, it's another for them to get watched. If you could go to the next slide, please, Katherine. They live on the YouTube playlist, and we promote them everywhere we can. So on some of the dating apps and hookup apps that Jamie referred to that are used predominantly by gay, bi, and same-gender loving men, there's a subset that are transgender interests about PrEP and hormone replacement therapy and what your options are there. They're all over our website. We do Facebook posts, and lots of our partners use them. So I think that's where some of you who are listening to the webinar can come in. They've been used in grand rounds as examples of LGBTQ friendly providers, what the language looks like, how you can talk comfortably and openly in easy to understand language for questions that people really have. We also have DVDs that we've sent around the country. They're used often in waiting rooms, and they have subtitles, so you can turn down the volume and just let people consume the information, or select a specific topic and share that either with your own provider network, with the rest of the team in your healthcare settings, or with your clients. So we welcome you to join us in making fun, frank delivery of information available to your communities. Just Google #AIDS or hashtag #AskTheHIVDoctor. And those are some examples of how we're helping to educate your clients and bring them in, hopefully with more questions to get great care from you. Thank you.
Thank you so much. You know, one of the things that I think is powerful, if we go back to the original definition, what is a community of practice? And it's a group of people who share a concern or a passion for something they do and learn how to do it better as they interact regularly. And the beauty of what you shared and what Dr. Barbara DiPietro is about to share is what a community of practice can do when we come together. And so with that, I would like to introduce our next speaker, Dr. Barbara DiPietro. At this time, she is the Senior Policy Director for 2 organizations, the National Healthcare for the Homeless Council and for the Healthcare for the Homeless of Maryland. In these dual roles, she is able to focus on national, state, and local health policy with a specific aim to ensure the implementation of the Affordable Care Act and making sure that it accommodates the unique needs of homeless populations. And Dr. Mena from #AIDS is a member of our community of practice, as well as the National Healthcare for the Homeless Council. So we thank you, Barbara. We can't hear. Barbara, can you please undo your microphone? Try to unmute. On the bottom left of the screen. And the beauty of social media, when things work well and when things are very interesting in the middle of a webinar. And as we take this time to see if we can get Barbara unmuted, I would just like to think about, you know, ways in which what we're learning about the community of practice and social media.
Katherine, it doesn't look like she's muted. It may just be the volume.
Okay.
She may have to turn up the volume of her on her mic. Yeah.
No, and she probably doesn't even know we're calling her. So, let's see. What we will do is, I want to do 2 things. I'm going to go to the next person, but in the meantime, I'm going to give out a smoke signal. Turn your microphone on, Barbara. And if she's locked.
Katherine, she's going to try calling in on the phone line.
Okay, so what we do, we're going to go to Dr. Laura Beauchamps. So Dr. Laura, who we came in contact with through Dr. Mena, who is a member of our community of practice and a consultant here at the National Center. So Dr. Laura is a board-certified infectious disease specialist who provides HIV prevention and treatments in Jackson. She works in several research studies involving young Black men who have sex with men and implementation of pre-exposure prophylaxis PrEP. Dr. Beauchamps. So what we're going to do, we're going to unmute everyone.
Can you hear me now?
Yes, welcome. We're so excited to hear your voice resonating across this webinar. Thank you.
Very good, very good. I think it just takes a moment if you're not in a computer, but it's great. Thank you for having me. I'm very excited to be a part of this webinar that is very, very interesting and very up to date with what we have to do these days so we can provide excellent care to the gender minorities that are coming to our clinic. So I just want to make sure that I go over the points of what Dr. Unruh went already, and then just emphasize that in every clinic, you know, that we provide care here, and hopefully this will be, you know, just, you know, an example for other clinics all over the state and in other places. We are all transgender friendly practice environments. You know, we have sex restrooms. We want to make sure that our patients get, that our staff members will get frequent transgender one-on-one, and making sure that everyone in the clinic is very respectful for the patient, you know, gender identity, and that everyone should be treated the same. So we want to make sure that we understand that these populations that are coming to us, they suffer a lot from issues with depression and suicide ideations, and because of all the social determinants that they have that will render them at risk for being discriminated against. So this is what our ultimate goal is, to make sure that everyone, every provider in healthcare would know about this, will be educated on how important it is to take care of this population, and so that we can treat them the same, but take particular, you know, interest in learn how to provide good care for somebody, and not like in the LGBT community, and not discriminate them as well. So even there is some data that even 1 hour lecture, you know, for medical students in Boston University was, you know, proof that basically if we do that on a regular basis, starting from med school or any other, you know, health, you know, medical education, will start changing the way that people are seeing the LGBT community, and will hopefully do superb job on trying to be very thorough in providing excellent care and prevention for preventable diseases in this community. Next slide. Yes, so as we said before, we want to make sure that we have strategies to creating a gender-affirming care environment. It's very important for the providers and the staff to be knowledgeable and have culturally competent and be very respectful. So we make sure that there is access to safe restrooms, all gender and gender neutral, and providing comprehensive transition related to care. We want to make sure that moving forward, we continue to work on our EHRs to make sure that we, you know, capture the right pronouns, and hopefully we can get some more data, accurate data on how is what is the disease burden in this population, because right now we're just not capturing that uniformly. Definitely try to train people, I mean, providers, staff, you know, everyone in the clinic to feel comfortable asking for the preferred names and pronouns, as we said before, and making sure that the whole experience will be a, you know, great experience from the beginning, front desk, all the way out to the phlebotomist or the janitor in the clinic. So I want to make sure that it is an excellent experience for them, so they can continue to come back, continue to be linked to care, and hopefully continue to come and get preventative services for like PrEP and STI prevention as well. So and then in talking about these, right, we want to make sure that we understand that the social media is so important in this era. So, and this is why we're bringing up this topic. It has been brought up that, you know, every single patient will use it. We have to be very, very comfortable, like as providers, knowing how the patients are finding their answers on the internet, and trying to provide seek care, like our ambassadors were saying before. So it is, it really breaks the ice, and you know, the patient can feel that we are really interested in their health if we know about this apps like Grindr, Twitter, you know, Facebook is a big one. We have actually used it in our research projects, and we know that a lot of our MSNs here in the South use the Grindr and the Facebook to get information about you know, medical care, and also to find partners, and to find just to know where they can get condoms for free, where they can go to an event and maybe get tested. So it is very important for us to understand that we have to speak the same language that they do, so that we can be more up to date with their real world out there. So we should be aware about that, and make sure that we bring it up, and not only that, but that we can utilize it so that we can promote health services and attract more patients that could get preventive services for sexually transmitted diseases and for HIV prevention. So it is very important, and we urge centers to get healthcare center website. That is a must, and make sure that you utilize it and update it so that patients can know what events are there, or what campaigns are going on in terms of testing, or groups are going on for them, of counseling, or any other services that you want to promote in your clinic. And also, it could be used for communication with patients to retrieve satisfaction surveys from each visit. So, using social media and then just internet, it has changed the way that we communicate with patients. So it's really a patient-provider communication through EHR has revolutionized the way that we communicate with patients. The patients could be traveling, they don't have to be expecting for your call. It could be just a text, a message through their EHR, and that really helps with accessibility to your doctor or provider. And basically, we use it a lot to see if there is how the patient experience from the clinic was right after the visit. So that's really important, that the patient would feel that you are, after the visit, trying to make sure that they're comfortable with their care that they received, and not only that, but make sure that their prescriptions went through, and that we could just communicate at any time. And of course, we should make sure that if there's a real eye-catching health advertisement should be included, and this is important. And not only that, but we want to make sure that people understand that in each clinic, if we are servicing LGBTQ community, is very attractive when they come and they see that we also hire and work with co-workers that are from that gender minority as well. I mean, it really blends in, and it flows better, knowing that we are knowledgeable about that. And we think that it should all be, the community that is serving, providing healthcare should resemble the people that are coming, so we can all feel the same.
Thank you.
Thank you so much.
Thank you. We're going to go back to Barbara on improving medical practice, the role of social media.
Great, thank you. Can you hear me now?
Absolutely. Yay!
Great. Technology can be most of the battle some days. So thank you so much for including me in this lineup. I know we've been talking a lot about LGBT and gender nonconforming populations, but we're also wanting to include populations experiencing homelessness and other patient populations that bring a unique experience. And under the rubric of just improving practice, I think one of the overriding themes that have been touched on by all of my colleagues so far this hour is just getting a better understanding of what your patients' experiences are, and what they're going through, what troubles them, what joys are going on in their life, really a holistic patient understanding. And so having a better appreciation then of how your patients are using social media, the kinds of information they're sharing on social media, can help you be a better physician or other type of provider, because you can then see through that lens that's available in a free, often free, platform that is publicly available. So when we look at like all of these, different platforms that people are using in very different ways, for our patient population, because of the instability of housing, we see people who are also not only making connections with friends and family and doing a lot that everyone does, but they're also trying to find services and resources and jobs. They're trying to find providers that are going to be sympathetic to them, And so people do, as Abraham talked earlier, and Jamie and some of the others talked about, people are very frank in what they're sharing on social media. And so they're getting information, and that information may not always be accurate, but that's, you know, again, where you as a provider can come in to take the issues that people are talking about and bring that into an honest conversation into your practice and the interface that you have with your patients. There's such precious little time to do face-to-face patient care. And so when we think about the more as providers that we can get as a perspective, and the more understanding that we are of larger issues before we walk into the exam room, the better prepared we are to have a frank and honest conversation that builds trust with individual patients. So there's a big list here, but if we go to the next slide, it's really about how then you can be leveraging that in your own practice, and how you might be using social media, not only to engage with others in seeking a greater understanding, but thinking about who are you following, and engaging in conversations. How are you as a provider contributing to a constructive and thoughtful conversation online? How is it that you can be posing questions or providing information that people might need from a trained professional to make sure that people are getting accurate information, that you can contribute, particularly in rural areas or areas where you may not have the diversity of providers that give people choice. There's a lot of places in this country where if someone goes in and has a terrible experience with their provider, there isn't anyone else in town that they can go to. And so I was delighted to hear just some of the testimony from earlier where people had choices. I had a bad experience with this provider, so I had another place that I could go, and that met my needs. But I think about people who don't have that ability for various reasons. It may simply be that they don't have transportation. So again, thinking about how can you engage? And this can look a lot of different ways. Your professional organizations, think tanks, advocacy organizations, who are you following on Twitter and Facebook and videos you're watching on YouTube? And so how are you engaging in those platforms of discussion? Thinking about consumer advocacy groups, and think about how our political leaders are making decisions that have very direct influence on not only the practice that you can provide, but on the services that your patients have access to. And so thinking about the information that you're able to share in an educational way with our public policy decision makers. And this can be literally your mayor, your city council members, your state delegates, your federal delegation, so that they have a better understanding. And all studies show that medical professionals have very high credibility in terms of the information that our decision makers hear and listen to. And so that's what we need in our conversation, is having your participation. So thinking about sharing your experiences, sharing data or publications that you come across that you think would be of help in moving the conversation forward in a constructive way. Another thing, looking about themes and trends in care. What are people talking about, either in your area or in your field of expertise? And so how can you take, again, the wealth of information that's available and bring that into your practice and incorporate that into the conversations? And earlier we talked about how you can have those conversations in a way that feels natural. But again, this is about you being open to the information you're getting before you even walk into that exam room. And I think one of the things I'm particularly interested in is the integration of service and advocacy, because I think we often think about clinicians and providers in that one-to-one role, but thinking about how we can really be part of a larger conversation about healthcare that I think is desperately needed right now, to be able to raise issues in a credible way that's data-driven and influenced by practice and compassion and an ethical moral standard, I think is really helpful. And I think articulating the value of why that's important, why it's important we do patient-centered care, because it yields better outcomes. And so one of the things I'm really excited about, this is just one example of many, but on Twitter I follow Invisible People. There's a lot of videos that this Twitter account uploads of people experiencing homelessness who are doing their own storytelling. And by watching these videos, you can just get a better understanding of what are the realities of people's lives. What are the medical issues that they encounter? How are their injuries and chronic conditions exacerbated by their lack of housing? So again, just thinking about how you're able to take that information and inform your own decision making. Next slide. Just want to wrap it up by saying storytelling and really being able to compel how we're articulating the experiences we have. Here's a couple of resources, but there's a lot of storytelling guides out there. So I just want to wrap up by saying that I think this is a really valuable conversation. We're all working with unique populations, but again, these are the kinds of things that are just making us better providers by being more open and honest and candid in the conversations that we're having and how we're leveraging the platforms and social media that are available to us. Thank you.
Thank you so much, Barbara, and thank you all. I'm going to go to the last slide, and as I do that, just thinking about the objectives that we start this webinar with today, I think we've definitely identified at least 3 ways, definitely more than that, how social media can impact patient-centered care and clinical operations, the importance of practicing patient interviewing and questioning that builds trust and trustable information, and then identifying strategies that can be used via social media, the importance of culturally and linguistically appropriate services, and performing a patient-centered sexual history using an electronic medical record. We also have on the webinar today our center leadership, Dr. Patricia Matthews Juarez, Program Director, and Dr. Paul Juarez. In addition to that, we have our team here at the National Center for Medical Education, Development, and Research located in the School of Medicine at Meharry Medical College, Nashville, Tennessee. I've listed our investigators and faculty, consultants, and research assistants. And what we will do now, we're going to open up the floor for just some Q&A. And I would like us to keep this question in mind. How can we utilize social media to transform medical education and clinical practice? And thank you all again, and we are going to unmute all the lines, and Dr. Juarez and Dr. Laura are on to help navigate the answer to that question and where do we go from here as a community of practice. And remember, this is our first of 2 webinars on this topic, so thank you all again.